Today to talk to you a little bit about the perinatal oral health care. This presentation is a part of my internship with the Department of Public Health, Office of Oral Health, and the State Dental Director, Linda Ferreira, is supervising this presentation and everything that we're going to talk about. So let's see. So I'm going to try to speed it up a little because we don't have much time left. So the main goals of the presentations are to make you more comfortable referring pregnant women to a dentist, which you already do. So there's going to be a few facts on oral diseases. Some of the stuff you might already know, some of them might be a little newer to you. So that's basically the goal of the presentation. And why we talking to you about it, and just because we already know that WIC is the largest provider of the nutritional services to low-income families, and that's the population that we are also interested in, because in majority of cases, these people have limited access to dental care. They have limited knowledge, there is language barriers, income barriers, so we want to make them more knowledgeable through you guys and help them get the care that they deserve. And so we're going to try to build a collaboration with staff to address the pregnant women in particular and their children. So why is it important? The American Academy of Pediatric Dentistry recognizes perinatal and infant oral health care as a crucial in achieving healthy pregnancy. So we want to address the mom to make sure that her pregnancy outcomes are the best, and in the future her children will be cavities free. So we want to start as early as the time when she's pregnant. Why we think there is such a big need? Because many of them, when they're pregnant, first of all, they have other things going on, as you know, and they don't even think about their oral health. There's other stuff usually going on, so they don't seek dental care right away. So that's something that we want to remind them about. We want to let them know that this is important and that's a priority. Some of them don't know that they have to go, some of them will go, and the doctors are refusing to see them because they're pregnant. So we're going to talk a little bit about that. Some of them are completely unaware that oral health has anything to do with their pregnancy or children in the future. Let me just do it a little bit. In the future, they don't know about the implications, they don't know about the impact on the unborn child. We want to let them know that diseases in the mouth can be transmissible, they can be chronic, progressive, and the most important, they can be prevented. So that early intervention is very, very important, and we want everybody to be on the same page, including nurses, nutritionists, pediatricians. That's something that already is going on, because I'm not sure if you're aware, but the pediatricians are also applying fluoride for children, and they're making sure that they go and see the dentist as early as the age of 1. And that's the same thing you guys do, and so thank you for that. So again, the good oral health contributes to healthy pregnancy and overall health. So there's many, many recent studies that report the strong association between oral disease, and in particular we're talking about the periodontal disease, and I'm going to talk about it a little more. And they proved to some extent that periodontal diseases do cause adverse pregnancy outcomes, such as preterm birth, low birth, preeclampsia, or gestational diabetes. So they actually found out that the American Dental Association found that pregnant women with the chronic gum disease are 4 to 7 times more likely to deliver prematurely versus mothers that have healthy gums. So mothers with the most severe periodontal diseases deliver prematurely at the 32nd week. So this is something they still work on. They do more research, so it's been challenged in the literature a few times, so they want to prove the definite association. And this is the most important, what I want to concentrate on is how to recognize those diseases and which ones are the most important and the ones that can impact the pregnant women the most. So we're talking about gingivitis, periodontitis, which I'm sure you all heard about, as well as dental caries. Gingivitis and periodontitis are the diseases of the gums, and these are the ones that might have an impact on the pregnancy. Dental caries have more impact on the unborn child, and we're going to talk about it, as well as the health of the mom. So gingivitis is the base